You're doing great. Okay, so this is a presentation on the lymphatic system. At the end of this presentation, you should have a better understanding of the lymphatic system, the functions of it, what can happen when you do not have a properly functioning system, the importance of supporting the body's lymphatic system, and how we can support it. So let's dive in. These are our topics. So obviously, what is the lymphatic system, the functions of the lymphatic system, the parts of the lymphatic system, how does the lymph flow, disorders, lipedema versus lymphedema, lipedema, a reason for our compression therapy, and then a reason for BallancerPro, and any questions you guys might have. So, and when I say our compression therapy, I just want you guys to know that Alina does have the ability to order, and we have the ability to order for retail purposes, products that they can use after they leave, and that's what we'll dive into. So some quotes: move your lymph system. Lymph is like a sewage system that carries all of the toxins out of your body, and a healthy lymphatic system can fight off 80% of chronic diseases such as cancer, heart disease, arthritis, and so much more. So what is it? Your lymphatic system is part of both your circulatory as well as your immune system, and it has a number of key functions in the body. Commonly, the lymphatic system is a forgotten system until it starts to act up, and many clinicians often forget the importance of it, and or they haven't been properly trained on it. The main function of the lymphatic system is to protect the body from illness-causing invaders, maintaining your body fluids, absorbing and transporting the fats consumed in our digestive tract. And the most important thing is it helps to remove our cellular waste. So if there's any blockages that occur, diseases can arise, blockages that can happen for a number of reasons, and from everything from illness, viruses, bacteria, to surgeries. And when it does rear its ugly head, we begin to think about supporting it. The system is a network of tissues, vessels, organs located throughout the entire body, which help to move a colorless, watery fluid called lymph back into our circulatory system. So we have about 3 liters of this fluid, which needs to be returned to our bloodstream daily. That's where the lymphatic system takes over. It collects this excess fluid called the lymph, removing it from our tissues, and eventually delivering it to our cardiovascular system, where toxins can then be eliminated by filtering the blood through the liver and the kidneys. So the functions of the lymphatic system: it helps to protect the body from foreign invaders, again, transports and removes the waste products and abnormal cells from the lymph, which is super important. I think I'm going back. Sorry, guys. It absorbs fats from the digestive tract, and it helps to maintain fluid levels in our bodies. So I'm going to play this quick little video for you guys.
The lymphatic system supports the cardiovascular system and functions as part of the immune system. There are 3 main types of structures in the lymphatic system: vessels, nodes, and organs and tissues. Lymphatic vessels can be found throughout the body. They collect lymph, a clear fluid drained from the body's tissues, returning fluid to general circulation. Lacteals are special lymphatic vessels found in the villi of the small intestine. You can see them in the villi microanatomy model. Fatty acids from chyme that is digested in the small intestine pass into the lacteals, mixing with lymph to form a special fluid called chyle. This fluid is how lipids get from the gastrointestinal tract into the bloodstream. Lymph nodes filter the lymph that passes through them, and they add white blood cells called lymphocytes to it. Lymphocytes, or lymphoid white blood cells, include B cells, T cells, and natural killer cells. We can see these different types of white blood cells up close in visible biology. B and T cells play important roles in the body's adaptive immune response to pathogens, and natural killer cells are an important component of the body's innate immune response. Now let's go back to Atlas and take a look at some lymphatic organs. The thymus is located just above the heart. Its main function is to serve as the site of maturation and specialization for T cells produced in the red bone marrow. It also produces hormones that regulate T cell development. The spleen is the largest lymphoid organ. It helps filter the blood by removing dead red blood cells and platelets and recycling iron. It also contains tissue where populations of lymphocytes increase. When I say the word tonsils, you're probably picturing the palatine tonsils, which are located at the back of the oral cavity. These small lymphoid organs help defend the body against pathogens. They have folds called crypts, where lymphoid cells accumulate and kill bacteria. Palatine tonsils aren't the only set of tonsils in the mouth and throat area. You can find other tonsils at the base of the tongue, the posterior wall of the nasopharynx, and the opening of the pharynx's auditory tubes. Want to learn more about immunity and the lymphatic system? Check out the 3D models.
Okay. Let's skip. All right, now it's not letting me bypass. Let me figure this out.
Did you know that heart disease is the leading cause of death in the U.S.?
Stop. All right. Sorry, guys. For some reason, it wouldn't let me pass. Okay, so this is a beautiful image of everything she just covered. And the one thing I'd like to point out is the thymus. Simply for you guys, Tyler, that's where the epitalon is working on, helping to stimulate. So it works really well in conjunction with the BallancerPro. So again, in more detail, if you'll want to download these, this will go through in more detail the different parts of the lymphatic system. And then this is another really great video. So hopefully I'll have better ability to skip after once we're done.
Did you know your body has its own version of a sewer system for removing unwanted toxins, waste, and excess water from the body? This is called our lymphatic system. Like our blood circulation, the lymphatic system is made up of millions of little vessels that branch all around our body. But whereas arteries and veins carry blood, the lymphatic vessels are much, much finer and carry a colorless fluid called lymph. Our lymphatic system has three main duties. 1. It contains white blood cells called lymphocytes, which are used to fight infection. 2. It acts as a one-way drainage system, transporting fluid from body tissues into the blood circulation. 3. It gets rid of waste products produced by cells. As blood circulates the body, plasma leaves the blood vessels and travels into the body tissues, delivering food, oxygen, and hormones to the cells. This plasma becomes tissue fluid and surrounds all our body's tissues. It then collects waste products, excess water, and toxins from the cells. 90% of this fluid passes back into the blood circulation. However, 10% of the fluid is left behind and is known as lymph. We therefore need a system to drain this lymph fluid so that we don't end up as a swollen fluid-filled balloon, hence the lymphatic system. The lymph fluid drains into lymph vessels, where it then travels to lymph nodes, which are found all around your body. To stop backflow, the lymph vessels have one-way valves and muscular walls that contract to force the lymph forward. This is happening in millions of little lymphatic vessels in your body every minute, every day. The lymph nodes filter the lymph, destroying or trapping anything harmful. The lymph nodes contain white blood cells called lymphocytes, which attack and break down bacteria, viruses, damaged cells, or cancer cells. This filtering and destroying is an important part of our immune system and stops nasty substances being fed back into our bloodstream, which would make us sick. The waste products and destroyed bacteria are then carried in the lymph fluid through larger lymph vessels up to your neck, where the thoracic duct empties the lymph back into the blood circulation. The bloodstream then removes the waste products from the body as it does with other waste. As well as the lymph fluid, our lymphatic system also includes a few organs: the spleen, thymus, tonsils, and adenoids. They all have roles in helping our body fight off infections. Unfortunately, like any sewer system, things can go horribly wrong. Sometimes we get infections that cause the pumping to break down. This can cause your arms or legs to swell to huge proportions. Sometimes the debris or other bad substances can make it past lymph nodes. Sometimes cancer cells do this and spread the cancer to other parts of the body, which obviously isn't good. For now, we wish you all the best for your lymphatic health, which you can help maintain by drinking lots of water and exercising. Keep on pumping.
If you liked the video, give it a thumbs up and
Right. So again, this is more detail. You can read this afterwards, but said in another way, the lymph always moves in one direction, starting from the furthest part of the body distally in the direction towards the heart proximally. The lymph valves prevent the backflow because of the buildup of pressure from the lymph, and it forces them closed. They operate similarly to the valves in your arteries. So you can think of the lymphatic system as a lazy river, or as attempting to fill multiple buckets of waters with your hand. So you can see that attempting to fill buckets of water with in this way could be very time consuming. So too does it take time to move the lymph in your body. When the lymphatic system isn't operating effectively, it is essentially like filling a bucket with now only one hand. This is why supporting the movement of the lymph is critical for everyone. But when you do have a backup and a backflow of the lymphatic system and there's disorders, now it can lead to some serious diseases. The most frequent of these is lymphedema, which affects mainly the extremities. When a disorder of lymph drainage develops, protein-rich fluid accumulates in the tissues, like you saw in the video. And as in chronic inflammation, increased amounts of mononucleotide inflammatory cells, the monocytes, migrate to the area, and then these monocytes transform into macrophages and multiply. These macrophages will produce increasing amounts of signaling I can't speak this morning, substances, which stimulate the fibroblasts to divide and synthesize more connective tissue. And some of these fibroblasts will then transform into lipid storing at basically fat cells. The late complication is typical of lymphedema and proliferation of these fatty tissues. Therefore, the long-term effects of having increased levels of inflammation results in increased levels of your fat cells. So again, you've got lymphedema, which is a swelling or accumulation of fluid in one extremity. You got lipedema, which is going to be inflammation inside your fat cells. And typically this will be in two extremities. Then you have swollen lymph nodes, which ironically enough, my husband just had. And then you have cancers of the lymphatic system. So this is an example of the difference between lymphedema and lipedema. So I know that a lot of the clients that we have at the Recovery are going to be generally healthier, but I've treated several people with lipedema, and I've had to get creative with BallancerPro in order to treat or help individuals with the lipedema that are of this size. So, and the BallancerPro actually works phenomenally well for lymphedema patients for these guys. So when we set the millimeters of mercury for, let's say 40 millimeters, it's going to inflate the two sides of the legs at a different rate, and it's constantly reading because it has sensors throughout the entire pants or jacket. So you guys can read a little bit more in detail here, but this is essentially what's going on. This is in a healthy system. The fluid will drain into the lymphatic vessels, whereas with lymphedema, you have a blocked fluid causing swelling. So you can see that the fluid is being built up in between the fat cells and the skin, and it's not draining as effectively into the lymph vessels and into the lymph nodes. So these are the stages.
Can I add something quickly?
Yes.
So we did a lot of studies in Germany, especially the BallancerPro, being used in lipedema clinics. And these are, for example, the stage 4 conditions of lipedema and lymphedema. In its origin, the BallancerPro was exactly developed for these patients that suffer from lymphedema and lipedema. Hence, it is super effective on anyone in greater health than the worst case scenario, which is why we see these exponential results on relatively healthy individuals. Another thing that is oftentimes unseen is that obviously lymphedema is going to be the visual manifestation of a disorder of the lymphatic system. There's a lot of steps prior to that that almost everyone has. We have a slide for this that I can share later. Maybe Ryan, you have it in your presentation, but it could be anything from fatigue, brain fog, migraines, unresolved swelling or weight gain, hormonal changes, all of these things, just imbalances in general, or when your patient or your customer tells you, I used to be like this and now things have changed, I don't know why, or oftentimes we call the mystery diagnosis when you have we work with a lot of functional medicine doctors that work with fibromyalgia patients or Lyme disease patients. These are all conditions that revolve around the chronic inflammation present in the body, but the BallancerPro is phenomenal to help. And you may not see that the customer has that going on yet. They may experience some of the more common symptoms up until they become visually obvious. So I just wanted to add that in. So before we actually see the lymphedema or the lipedema, there's a lot of subtle steps prior to that where the patient can really benefit from any sort of lymphatic massage and BallancerPro treatment.
And I do know that I have that slide. I just can't remember if it's a slide in this presentation or next week's presentation because I worked on both of them. So, but I know which slide you're referring to. So,
okay, perfect.
Yep, so you guys will see that, and I'll upload it into the locker so you guys can utilize that if you want to go ahead and print it out and use it as a sales piece to talk to your clients about lymphedema and lipedema. So,
hey everybody, Dr. James Schwartz. Just want to tell you today is World of Lymphedema. And the reason I'm talking about this is I treat a lot of lipedema as well as lymphedema. And I wanted to talk to people about the differences. Lymphedema is a very common disorder that we see. People know about it, they've heard about it. It's called elephantiasis of the legs. You'll see the people that have one leg that's a lot larger than the other. It usually isn't painful, and it can really, by wrapping and compression, can really help with that. Lipedema is different. Lipedema is connective tissue. It's actually a fat disorder. It's very, very, very painful. So people will get in their legs, both legs, down to the ankles, will get really swollen and hard, but also very painful. The difference, if you're just looking in the mirror, lipedema does not go to the feet. Lymphedema, the feet, ankles, toes, everything will swell. Any questions you have, please reach out to us.
and then there was one other video that also talked about the difference between seeing the visual differences between lipedema versus normal fat. And this is a plastic surgeon actually talking about this.
Dr. David Amron again. Can you decipher regular fat from lipid fat? This question comes up a lot. If you're in the urgent liposuction, you can tell what's a lipedema cell, what's not a lipedema cell. These are essentially, they're fat cells. The lipedema cells have gotten there by a different process. Leaking of the lymphatics, swelling, deposition of stem cells in a layer of fat. They turn to early fat cells called pre-adipocytes that are really normal fat cells that start replicating. So you're not plucking out each individual lipedema cell and leaving normal cells behind. You're doing proper liposuction on that layer of fat between the skin and muscle and bring that whole layer down to a very, very thin layer. And in that liposuction, you are removing both lipedema, so-called lipedema fat. You are removing normal fat and doing a beautiful job of liposuction, and that's going along with it. And you are also releasing fibrosis, which is the next thing. Lipedema fat tends to look a little bit different than your typical normal fat. Normal fat is more yellowish in color, more like chicken fat. Lipedema fat becomes a little more like beef fat. That's more of a white liquid. Now, why is that? because of fibrosis, that's part of the condition of lipedema. And that's why it's important. You're doing proper liposuction, you bring that layer down uniformly and completely, you're respecting the skin, and you are maximally decongesting, releasing fibrosis.
All right. Oh, you know what? I do have it on this slide. So this is the slide that Elena was talking about previously. So the lymph vessels carry 75% of the waste rejected by our cells. And you know, if you've got a clogged symptom because you're experience regular headaches, muscle pains, bloating, constipation, skin breakouts, itchy skin, cellulite, weight gain, water retention, fatigue, edema, leg swelling, weakness, weak immune system. I can tell you right now that I worked a conference called CryoCon, and I did a 10-minute session. I didn't realize how backed up my system really was. And at that 10-minute demo pretty much sold me. I just had to go back and convince the husband to spend the money that I needed in order to get it. But with my competition, it really has helped me significantly not cut my calories as much, so that I can get the fluid and show the muscles. I can get the fluid out and show my muscles the way they need to. So if you have clients that do any bodybuilding or anything like that, the BallancerPro is an absolutely phenomenal device to utilize. They can actually utilize it if they have the pajama set. They can utilize it even after they've been sprayed, as long as they're completely dry, and they use aligners. So just an FYI. So, and this is goes right into the reason for our compression garments. So the compression bandages with suitable padding and medical compression garments with a textured surface in combination with movement have been shown to produce a micro massage effect that improves lymph transportation, which is why on the pants have that pattern. They should always extend as far as the next large joint. So if you're trying to remove edema in the ankle, you want it to go all the way up to the knee. Skin temperature also increases by 5 degrees, especially under heavily padded compression bandages. I'm sure that you guys have seen your breast cancer survivors with the sleeve. So those actually help to eliminate the edema in their arms. And these compression garments need to be at least 30 millimeters of mercury, but no more than 60 for the lower body, and between 14 and 25 millimeters of mercury for the arms and the upper body. 2 garments should always be used alternately. So when you are selling them to your clients, sell them 2. So one they can wear and one they can wash. And they really should be replaced every 6 months, especially if they're using them on a regular basis. So these are some images of the activewear that Elena has, the top and the bottoms. I love to fly with them. They work really, really well. I personally like a tighter fit. So it can be quite challenging to get into them, but that's my personal preference. And the closer I am to show, I will use their sleepwear, which I don't think I have any images of, underneath these. And I give myself that little extra millimeters of mercury, because Elena, correct me if I'm wrong, these will provide up to 30 millimeters of mercury, and the pajamas are between 10 and 15, correct?
Exactly. So these actually can go up to 35, and just like you said, depending whether you size them down or up. And what's most important about these garments, they are a breathable microfiber. It's a patented fabric that's designed in Italy, and they have the patterned surface, as you mentioned. And what they also do is they're spun in a circular woven pattern. So it's almost like wearing a ring around your skin to create a constant compression to avoid any fluid to sit in the tissue too long. So especially when your customer has left the recovery and finished their session, on the 2 or 3 days in between one and the next BallancerPro session, this is the optimal tool to wear. Of course, if you're in competition mode or even traveling or for daily use, it's fantastic to wear these. We always tell people you don't have to wear them longer than 2 hours. We actually recommend to take them off after that. But a lot of our clients, they say, oh, they feel so good and comfortable. They wear them up to 8 or 9 hours a day. So we definitely, we don't recommend at night. That's why we have the sleepwear. I figured, Ryan, you'd be guilty of the extreme.
Of course. That's why I did this. Yes. So I am typically the one that will wear them between 4 and 8 hours for sure. So, and then the sleepwear, I usually, like leading into the show, I basically come home and take my shower, I get all clean, and I try to wear them a minimum of 8 hours. So this is a great little video on what's going on with the BallancerPro. And I think at this point, I'm going to let Elena talk about it because it's her baby and she can do a better job at it than me. So I'll just turn this off for now. You guys can refer back to all of this later when I upload, but
we can go back. Thank you. We can go back to one slide where you showed the animation of cells inflating. I can say a few words about that, and then we can go to the next slide.
Perfect.
Do you have the previous one? Yes, perfect. Okay. So what you can see here, and this is grossly simplified because, as you know, the BallancerPro goes all the way right below the heart, and you already know now why, because we saw in the video here what you see in teal color right above the heart is the thymus, and it's a very important organ for our lymphatic system. What a lot of individuals don't know, and I'm not talking about patients, I actually train surgeons and doctors on this, and they do not know. What a lot of people don't know is lymphatic massage or lymphatic drainage. The process really begins in the abdominal area and drains by the thoracic duct. Our thoracic duct and our lymphatic duct is right if you touch by your collarbone. That's where the lymphatic fluid can, for the first time, even leave the lymphatic system, enter the circulatory system, and then get excreted. By excreted, we mean after 40-minute session in the BallancerPro, we typically recommend have your customer nearby the next restroom because that will be the next stop. And that's why it's so phenomenal in terms of recovery, because toxins have actually been flushed out in that one session and have had the opportunity to then leave the body. There are many things that take the claim to fame to say, oh, we promote lymphatic drainage or enhance lymphatic drainage. True drainage has only happened when the fluid has actually exited, left the body, and that is the drainage process. And that can only happen if you work with a garment that covers the thoracic, the abdominal area, and also with a jacket that covers the upper area for the lymphatic ducts. So our lymphatic system actually drains in two opposite directions into two opposite ducts. So probably Ryan has another slide about that where we can get into more detail later of the flow direction of the lymphatic fluid. But what's most important about the BallancerPro is not only is it a circumferential adaptive massage that adjusts to the difference in volume of the limbs, and it's basically delivering a customized massage for anybody that gets in there, whether it's an 8-year-old kid or a defensive lineman or an obese patient that wants to lose weight. It's for any body size and shape. You only need that one garment set. You can use the expanders, of course, for optimum fit, but the sensors in the suit allow for this treatment to be a custom treatment each and every time you start the treatment for anybody. And what's important, and you can see it again, grossly simplified here because the chambers are actually not capped off in a sequence. They are actually overlapping like fish scales, mimicking the hand over hand technique of the manual lymphatic massage. And they actually move all the way up into the thoracic duct. That's one of the biggest takeaways and differences. It's actually a patent that not only design patent, but also functionality patent that we've held for decades. And it's really important to understand there's no other technology that can deliver this. So that is definitely a unique selling point and a standalone factor of the BallancerPro treatment, and why most people get in it and they say, oh, this was really different, or this is different than I expected, because they can instantly feel the results. And while we love to hear the BallancerPro being a miracle machine, I have good news for you. You already have your miracle machine. We all have it. And it really just mimics what our body would be doing at its optimal health performing level. And that's what I love so much about the BallancerPro. It's the most non-invasive and safe treatment you can offer, besides being FDA cleared and all of that stuff. But I put my friend's children in it. I have a so he's still too little to get in, but as soon as he can use it, I will have him in there. It's just a really healthy and safe treatment to do, and it's extremely effective. And that's really the biggest takeaway. And the way it does that is it's mimicking your body own fluid movement, but speed up times 60. So in the optimal health state, if we weren't dealing with any outer factors or any interference with our healthiest lymphatic flow. A reason for the BallancerPro, beautiful slide. And I see our lovely Dr. Ava Shamban, very famous doctor, who actually was on multiple TV channels talking about it. She's not paid. This is her own activity. And we're very grateful for that. She was one of the first. She's a published author and dermatologist from Beverly Hills. She owns 5 med spas there and 2 dermatology clinics. And she actually uses the BallancerPro in combination with body contouring treatments, whether it's with the M-Shape well, or for example, with any cryo fat freezing treatments, because she sees, they call it the slimmer at her clinic, because she sees such dramatic weight loss results with her body contouring patients. In addition, they use it to clear up skin. So in combination with the HydraFacial, they also have protocols. And typically most of the med spas we work with that are tied to a medical director or a plastic surgeon, they use the BallancerPro in combination for post-op protocols, in combination with any of the med spa treatments, whether these are aesthetic treatments or body contouring treatments. You can also find the BallancerPro in some of your favorite sports teams, athletic training rooms, where it's then used post-op after orthopedic surgery or after injury to get the players back on the court or on the field faster. Something that I find very noteworthy, we actually have a vendor contract with the NFL Workman's Comp, and their health insurance pays for the BallancerPro as a recovery tool, because statistically it has proven, especially in football where the season is so short, where players have a very limited time to recover from an injury, to get the athletes back on the field much faster. So they rely on the BallancerPro for not only faster recovery, but also getting that injured player back to optimal performance levels. So there's a myriad of combinations where you can offer the BallancerPro. Oh, beautiful slide. Everything we just talked about, from aesthetic to athletic, then of course the wellness benefits. It depends how you look at it. A lot of people like the BallancerPro for the wellness benefits, and they take the aesthetic as a nice additional benefit. A lot of people like the vanity aspect and say, oh, I wanted this for my cellulite, but now I'm feeling better and I have more energy. So you can, it's a very multidimensional approach to your selling process. So it's literally no matter what they come in with, they will benefit from this treatment.
Yes, and users usually enjoy it. It feels absolutely fantastic. Some people get energized. I personally generally tend to get, like I'll fall asleep in it. Even if you're talking to me, the very first time I tried the jacket, I fell asleep when Mary was talking to me, and I zoned out for 20 minutes. And then as soon as I got out, then I got that nice little boost of energy, and I just felt great. So, and then frequency of use. So the more often you use it, the better the results that you end up having, depending on what your goals are. You can, if your goals are to get ready for a red carpet event, you want to try to do them between 40 and 60 minutes every day for a minimum of 12 sessions. And then you'll typically, the average American will lose at least a dress size, if not more. And then for athletic recovery, our protocols would be somewhere around the 30 to 40 minutes time frame. And generally you, it will give you about 2 days off. Like it's the equivalent of having 2 days of rest and recovery. And then if you want to, if you're healing from an injury and you're not really able to properly warm up before you are going to train, doing about 20 minutes pre will help to warm up the body as well. And then doing it after your exercise will help to enhance the recovery process. So when my trainer was very sadistic and we ended up doing legs 4 days in a row, I lived in my BallancerPro pants. So do you guys have any questions? I think right now it's just the three, no, there's 5 of us. So Tyler, Logan, Amy, do you guys have any questions for Elena?
I don't have any specific questions. That was a great presentation though.
Awesome.
Agreed. Yeah, the lot. I mean, I knew about BallancerPro for the vanity aspect, honestly, and all of the other stuff was a wonderful bonus to learn about. So I appreciate the information.
That's great to hear. And I have to say, Ryan, you did an awesome job. My lymphatic health training, usually I can barely keep it under an hour, and that is still very simplified. Coming from Germany, where just the lymphatic specialty certification takes 3 years. Imagine how much information there is. And what we are so grateful for is obviously you guys become the educators at your location, and everyone is very interested. I mean, lymphatic massage and lymphatic health right now is at an all-time high of researched words. So there is the demand in the market. So with you offering this modality, you will get people in the door that are looking exactly for the BallancerPro. And by you being able to address some of these things in a professional way, where you are not only an expert on the technology, but truly on how it works in our body, which concerns all of us, that's ultimately going to give you an additional competitive edge also to any other locations in your area. And that's what I think Discovery stands for, that, you know, it's not just a place where you get awesome tech, but you get education and knowledge about what you can do for your wellness. And of course, the aesthetic benefits is definitely what brings people in the door. But then you will see the wellness benefits in the long run is what's gonna keep people coming back. And they're gonna get their weight loss results. But if they see that they continuously feel good, you can easily keep them on a membership plan and keep them coming back for those benefits.
Yes, I have one question for you.
Yeah.
One question that I get asked a lot is, what is the difference between the BallancerPro and Normatec or other compression therapy? When would you want to use one over the other? And the other question that I have is if you could talk a little bit about the millimeters of mercury, as far as, you know, there are some people that really like that deep pressure versus, I know less is more, and it's taken me and my peanut brain a little bit longer to understand that physically. So I was hoping you could talk a little bit about that so other people understand it.
I'll be happy to. So you mentioned something really important. Let's talk about the pressure first, and then we can talk about the differences with other technologies that are in the market. So most important, and I think we touched upon this in this presentation, is that the BallancerPro is designed to deliver this very finely tuned custom pressure. When we talk about pressure, and this is something we could also maybe touch upon in the next presentation, is where does this pressure importance come from? So it's actually dictated by our body. So our own blood pressure is the parameter for which it is important to understand why we want to have our BallancerPro setting at 40 to 60 millimeter mercury. The most important part is to understand that when you're compressing, you saw earlier in the video, it is super important for the lymphatic vessels because they are attached to muscles. But if the muscles, you know, not everyone is equally active, and with the external compression, you can get the lymphatic fluid to move. However, if you compress too strong or too hard, you're actually congesting more or blocking lymphatic flow, and you're also inhibiting and limiting circulation. So what's most important on the BallancerPro, it walks that really fine line where it meets with optimal compression, yet true lymphatic massage. Anything that constricts blood flow is no longer lymphatic massage. And that will take you to your difference. What's different between, for example, Normatec? The Normatec is not a lymphatic drainage technology in any way, because you cannot control, number one, you don't have sensors in the suit. And as you saw in the video, it does not, if you've seen a Normatec device or the sleeves, as they call them, there are sleeves. They don't cover the most important areas in our body that are responsible for actual lymphatic massage or drainage. So you would use a Normatec, for example, on a super healthy athlete that wants to squeeze lactic acid out of their muscles and just get a quick oxygenation by contracting, closing off circulation and releasing. That will refreshen your tissue, but it does not have anything to do with lymphatic drainage. So the two are very, very different. The BallancerPro has the ability on some of the settings to deliver a really strong compression massage for muscle recovery while still walking that fine line of still deserving the title of a lymphatic drainage suit. That is only possible if the machine is built to detect the pressure, to adapt the pressure, and to deliver that. That's the same as if I tell you, oh yeah, my car is really great and maybe it can also fly. If it has no wings, it is not designed to do so. So I would say in comparison, we're talking about a plane versus a car. So it's unfair to say, oh, the one cannot do that and the other can. They're built to completely different standards and to completely different audiences also. A Normatec, and this is another big selling point for you, that a Normatec, your customer can eventually find it on Amazon and buy a consumer device for $600 and have it at home. So there's only so much you can charge for that session. A BallancerPro, we get a lot of calls from people say, oh, I tried it and I want to buy it. Like, oh my God, it's almost $40,000. And then they go right back to the location for the membership and treatments. So you're looking at a medical grade, hospital grade device that is only designed to be in the right hands, which is our business locations and trusted partner providers.
Perfect.
Oh, one more difference that I just remembered in terms of pressure. And sorry, my little one just woke up, so he's very happy to see me. So another big difference on the Normatec, you don't have the ability to regulate the different treatment modes or even compression. Compression just goes from 0 to 10. And that's as if I told you, I mean, you can't control the pressure there. It's as if I told you, here, Amy, please take my car, but make sure you don't go over the speed limit, but the odometer doesn't work. Somewhere between 3 and 5. That tells you a whole lot of nothing. So it's really important to understand what pressure are you applying to this very finely calibrated body of ours that does not want to go anywhere over, what's the blood pressure, 120 over 80, an average blood pressure. 80 has to be the max, and 80 does not feel like 200, which is, for example, what a Normatec does. So there's drastic differences. And if you have a patient that's on a weight loss journey, they cannot use the Normatec. It's just not the tool for that. Right. So any of those differences, I would always go through assessing the need and the goal of the customer and then making the recommendation. So if the words come of inflammation, weight loss, wellness, lymphatic massage, then you automatically know this is my customer for the BallancerPro. If you have someone that's, has any other indications that you can utilize another system for, then they can go in that direction. But the ultimate baseline of that is always the need assessment and discussing the goals.
Perfect. And then correct me if I'm wrong, if we have a client that has bought a package and has done several, but isn't noticing the aesthetic benefits, then we actually need to lower the pressure typically before increasing the pressure.
Correct. The recommendation for the BallancerPro for optimal result is always less is more. The ideal recommended pressure for results is 20 millimeter mercury below the lower blood pressure value, which in your average person is anywhere between 45 and 60 millimeter mercury. You will find people that say, but I really want that strong pressure and I enjoy that strong pressure. I know somebody in this room who does, but the goal is ultimately first go to lower pressure before you increase the pressure. The highest pressure is really, if you look at our treatment guide, it's really only recommended.
I think it's 60.
It's only recommended the highest pressure if you have a pro athlete really looking for that intense squeeze, then you can jump right into the wave setting.
Right. So, I just want to thank you very much for your time. I know your cutie patootie is, hey buddy, he's there, right. And you'll have to put your focus on him now. So we thank you very much for your time. And if there's any other questions that come up between now and our next presentation, I'll make sure that I give you a little heads up. And otherwise, again, thank you very much.
It was a true pleasure for me to be here. You did an awesome job, and coming from the lymphatic expert herself, I couldn't have done a better job. So this is very, very impressive. I think you did fantastic, and I'm so grateful I got a chance to join in, listen in, and also answer some of your questions.
Thank you so very much. Thank you guys for joining. I
Nice
really
meeting
appreciate it.
everyone.
Thank you both.
All right.
All right, thanks. Bye.
Bye.
I'm gonna stop the recording.